So we had an emergency case the other day of a patient who came in early 20s. She was about 55 days postpartum, and she had potentially retained products of conception, which essentially means that she gave birth and some of the things like the placenta were left behind in her uterus, and it can cause ongoing bleeding. She had been seen several weeks ago for the same issue and had actually been prescribed antibiotics, never picked it up, and apparently she had some mental health issues, and now she was presenting with fevers and stuff. However, when I saw her, I was just asking basic questions like what her name was, where she was at, etc., and she couldn't answer me. She was staring off blankly, off to the corner of the ceiling, kind of like this, and she wouldn't really respond. So I could not talk about the risk and the benefits of anesthesia with her. And I was kind of torn right now because you have this patient who clearly is having some sort of acute psychosis, likely schizophrenic, but clearly needs something done. However, she seemed stable and it did not seem like an emergency to me. So I called the surgeons and I was like, we can't consent her and I don't think we can go forward and do this surgery. So the surgeons came down, they saw her, and she was a different person than when they had originally consented her for the surgery. So they did agree with my assessment, but we ended up canceling the surgery. However, I know that eventually she probably needed that surgery, and without it, she may have gotten worse over some time span. So it breaks my heart because she keeps having the cycle. What would you guys have done, and did we make the right decision? What do you think?